Hi to everyone in Nursing 531 or at the end of Nursing 531, and you're wondering why do I have a PowerPoint up saying developing student course objectives and outcomes? Because I just wanted to, in closing, refer to a few different points, and I could look at the whole confluence of the course, basically how it unfolds from the standpoint of the sequencing document, the pacing schedule, or from the Canvas site with the modules. But I thought, let me just for a few minutes highlight something that I thought was really important relative to the take-homes. The course is one that is providing you a foundation for looking at the process of nursing education, for which you can apply anywhere. All right, there is no question that the bias has been in the academic setting, and looking at that from a standpoint of the strengths of the Billings and Halstead book, let alone the Smith book, which I didn't think was too much of a strength, but also just from the frame of reference of an academic program that's delivering the course, and then trying to look a little bit introspectively into what goes on at health care agencies, and certainly to where you are or are certainly aligned well with nurse educators there, or staff development specialists who are educators on the units, speaking to, again, maybe a different standard out there on the quality side with Magnet and Six Sigma and things like that again. But I think the process when it comes to something that's really at the center of this course, and that we talked about sort of in the middle, was the idea about design, and in particular that foundation, developing student course objectives and outcomes. And in closing, I'll just say the language certainly has moved towards the idea of learner outcomes, a learning center type of posture, which I'd mentioned actually in this lecture, and I think we should refer to for a few minutes then too. So we consider, when we're thinking about designing a course, now whether that is teaching modules or some kind of program module for teaching new orientees or doing annual research on trainings at a given hospital agency, or does it involve even modules that might be utilized not just for employees within the broader system, but maybe even for patient education. Always think about that grounding, looking at, again, broader program goals, and then linking to the type of goals that might work for the educational project you have in mind in particular. And then we drill down on specific course goals and outcomes. And again, learner outcomes tend to be more the vernacular now. Teaching strategies, the content itself, student learning activities, and evaluation of student learning, which we've all had just a little bit of a taste of here. And in particular, with the curriculum critique and then the course proposals, we sort of see those things come together. We see the linkages, and that's what's really important here. Okay, so when we think about it back into a broader curriculum, which is more indigenous to academic settings versus maybe at a healthcare agency, we understand the progression and the layers that go into this better. So look, always plan evaluation first. What do the learners have to achieve? What do we want them to get out of it? And how are we going to measure that in some way? So hence that refers to, again, that evaluation process. We think about that first, even if we do it last, okay? So that linkage, that is strong there. Always think about, again, other things that need to be allied with our courses. So if it's an academic setting, prerequisites are concurrent or other courses, okay? But think about the sequencing as you progress. And certainly, I think for those who are nurse educators, they certainly do have a sense of thinking about that from a standpoint, especially when they're teaching people who are in more complex settings, so with critical care course modules, whether that's sanctioned from the broader, bigger CCRN professional organization or something that's done in-house. You think about build upon themes that work towards addressing a learning need for the population who's going to be working in that setting. So for the academic side, as well as that professional clinical side, we think about national healthcare organizations that might be the drivers, and we think about recommendations from professional nursing organizations in general. I know for me it's APNA, but certainly influential reports with recommendations for nursing education from those big entities that we've been referring to, AACN and NLN on our side, okay, and for the staff professional development specialists, if the ANPD organization sort of resonates and has some themes that speak to this, that's also great, obviously. And then, of course, in the end, we're sanctioned legally, so we do have to think about state and federal regulatory or accrediting agencies that may have some kind of influence relative to positions and the nature of how education may unfold for the learning outcomes that we need to achieve. And I think it was really well articulated from those that are teaching in complex settings with their assignment projects and with the DQs. Certainly from the standpoint of Amy and Sarah and Jill, we certainly heard a lot about that, relative to complex settings with specific themes. And then for Tracy, certainly in that school environment, a community-based situation, the accountability themes there, and of course for Stephanie relative to anesthesia and that culture. So there certainly are agencies or professional organizations that we answer to at one level, and we have to understand their language and their culture as we move forward. So in all that, if we're looking, again, just at the academic side, on the undergraduate side, we think about AAC and NLN in particular, but of course National Council of State Boards, because they're looking at the ultimate clinical testing or evaluation outcome. When I say clinical, I mean for training clinicians or healthcare providers, in this case, a state board exam. And NLN, of course, their expertise in particular, I thought, was the toolkits, helping nurse educators get grounded and effective too. Then on the graduate side, of course, AACN, CCNE for DNP and PhD, and NLN the same, but then NUMF, of course, then too for nurse practitioners outright. Okay. All right. So when you think about, again, how these things get written, how these things get linked, starting at one level with the program goal part, but then working back and thinking about course objectives or outcomes, in this case learner outcomes, and the competencies, how they're derived from the terminal and program level type of outcomes that we evaluate every year. In academic settings, we're always evaluating, in effect, then too, not just performance, but also perceptions at one level, in effect, then too. So we do think across the cognitive, the affective, and the psychomotor skills, in effect, then too. And a great tool that we refer to a lot that does support outcomes is simulation. That was a theme that we came back to, and it's something that's going to just grow and be more integrated into programs. Look at what we have at Cedar Crest now with the new labs and the great renovation to the HBB building for those areas, that simulation learning area. So so the learner outcome part, again, I'm harping on a term that's learner centered, because we need to recognize that some of that language does sound like it's changing, at least on the academic side, as opposed to the term objective. And then remember, we're always thinking in terms of measuring for things that we can objectively measure. So behavioral indicators, behavioral changes, in effect, then too. A lot of that, especially when we talk about active learning and student engagement, do speak to how we choose learning materials and guide the development of those learning activities that we use, in effect, and too. Now I'm just getting warmed up here. So I appreciate your comments on the evaluations to help me get there. So think about the theme about, I'll just say, learning objectives, but really in the context of learning outcomes. That's where we want to go. The actual learner outcomes and competencies must be written at appropriate levels, of course, for all to understand. Of course, so it's going to look differently in an academic context for junior versus senior level, and certainly it's going to look different versus graduate level type of thing. So think about that then too in healthcare agencies, if you were measuring the competencies of not just new nurses in orientation. What about the nurses who have an extended orientation and they're going into critical care type of settings and they have a preceptorship or they have a mentoring relationship? Or what also came up in this course, nurse residency programs, which really take it to a whole other level. So that's amazing when you think about that notion. So in all this, again, link. Make sure things link up and sync, and that's a good foundation for you think moving forward as you go into the education track practicum courses now then too, because you're going to be coming back to lesson planning, but now in a more deliberate way for a given course, and you'll think broader and bigger then too in terms of how that's going to meet the needs of a given course or a program going back into. So those linkages are really meaningful in all of this. So we always plan the evaluation at the beginning, even though we're measuring at the end, so in between we can understand the sequencing and that logic that goes along with that in effect then too. So anyway, I think that's really something for us all to be mindful of as we move forward. So anyhow, okay. We sequence things and make sure we're on task relative to broad themes, and even relative to things like the overall purpose for any program that we're implementing. So I think that's important. And then when we implement any kind of curricular plan, meaning a sequence, again, of outcomes we want to see achieved, in this case, instructors or nurse educators, I'll call them faculty here, albeit being content experts, they really just guide the whole process in effect then too. So you may have some informants within healthcare agencies for the staff development folks, the educators there, that can share some insights to this, but people who have been in this for a long time and are credentialed in that regard then too, whether they might have been, we didn't really talk about this in this course, again, clinical specialists that moved into an educator role, or even management. Just make sure that there's informed perspective on curriculum, and that helps sync the courses to the broader plan. For a healthcare agency, in this case now we're talking about academia then too on this PowerPoint, how that might look. So sequencing is important in addition to linkages, and understanding that content should be driven to being current, obviously best practice oriented, those kind of things that sort of support our learning in a didactic as well as clinical context in effect then too. So anyway, and always I'll remind back, think about a philosophy or a conceptual framework that works for you, something that you value. So you remember your nursing theory class, now make that meaningful with a practical application in terms of what you might design in effect then too. And outside of nursing, there are other theories in effect then too that refer to learning as well. But let's put it in that context. So again, what supports active learning in effect then too, and what addresses, maybe we're dealing with adults primarily. So we think about adult learning style and pedagogies. There's a few names that come to mind, Bandera and Kolb and people like that too, that we didn't really talk about too much in the course, but something to look up. So make sure that things are organized well, and there's linkage back to the big drivers, AACN, NLN in particular, are huge within this in effect then too. So the sequencing matters in effect then too. And it can be as simple or as complex as we need it to be in terms of the organizational strategies in effect then too. The lesson plans are what you're going to augment now moving forward. All right, so think about what goes into that. Then the name for the module you're addressing, the purpose, the outcomes, and the assignments and the evaluation strategies all can be part of a lesson plan effect then too. And think about that in the context of being concise, being focused, and realistic and all that. So here I'm going to just flip through that theme because these are all just closing thoughts and reminders in effect then too. But think about how you can meaningfully, as you go into the practical course, revisit the lesson planning process and implement it in a meaningful way. Okay? All right, so reflect deeply upon outcomes when considering revisions of objectives at the end of a program, and think about the linkages and the validation of the content. I wanted to say then, again, from my perspective, it's been a pleasure, okay, for me to be part of this course and for me to be part of your learning experience. And I thank you for your attention in all, and wish everybody the best at the holiday, of course, then too, and at closure point of this course, but as you move forward in our programs at Cedar Crest College. Thank you very much, and it's been a privilege. Be well.